Hey guys, high yield USMLE question for obstetrics and gynecology. This is completely applicable to step 1 because we talk about underlying pathology. It's completely applicable to step 2 CK and step 3 because we talk about clinical vignettes. All of these questions are freely available on my website with detailed explanations. So let's get started. We always start with the last two lines, two sentences. The uterus is uniformly enlarged and tender. What is the underlying pathology? All right, let's start from the beginning. A 41-year-old woman, gravida 4, para 4, presents due to heavy bleeding for the past 3 months. She had bilateral tubular ligation 3 years ago after her last delivery. Her BMI is 24 kg per meter squared. The uterus is uniformly enlarged and tender. What is the underlying pathology? Let's come to choice number A, which is the incorrect answer. Benign proliferation of smooth muscle cell, incorrect. Now, we'll come into the explanation, also look into that, but benign proliferation of the smooth muscle cell, this refers to leiomyomas or fibroids. These are irregularly enlarged uterus. As we spoke about over here on physical examination, the uterus is uniformly enlarged, therefore making choice number A, benign proliferation of smooth muscle cells, which is the myometrium, which are the fibroids, making that the incorrect answer. Choice B, local overgrowth of endometrium into the uterine cavity. That's the incorrect answer as well. If you come over here to local overgrowth of endometrium into uterine cavity, that's going to be polyps, which present as intermittent bleeding. Okay, so you're going to get polyps growing, which is going to present intermittent bleeding. So therefore, that's not happening here because we don't necessarily we do not getting necessarily intermittent bleeding. And over here there's more heavy bleeding. Okay, so that's going to be also over here. Choice number C, unregulated endometrial proliferation with increased gland to stroma ratio. That's also incorrect answer. Now unregulated endometrial proliferation with increased gland to stroma ratio, that refers to thickened endometrium lining, which slightly increase uterine size and cause heavy menses, which we do have. However, endometrial hyperplasia typically does not typically cause dysmenorrhea or uterine tenderness. In addition, the most common risk factor for unopposed estrogen with chronic anovulation and or obesity. This patient has regular menses and a normal BMI. I just want to talk to you about this. If a woman is obese, her BMI, let's just say 36 kg per meter square, her adipocytes are going to be converting androgens into estrone with an enzyme called aromatase. Okay, once we get that sort of conversion, what's going to be happening is that we're going to get too much estrone. Estrone will then stimulate your endometrial layer of your uterus to become hyperplasia. Hyperplasia means increase in number of cells. All right. Then we will be getting a very thick endometrium and we're going to be getting abnormal bleeding. Another thing is when you about obesity is when you get too much obesity, we get increased insulin. Insulin will mess up your GnRH, okay, and that will lead to more LH, which stimulates. Now we're talking about the ovaries on the sides, okay. That's going to be stimulating your theca internal cells, which are going to then lead to more androgens, and you get more hirsutism, male pattern baldness, voice thickening, muscle mass, cytomegaly, or we can also get we're going to be also getting less FSH. So we're not going to be getting that much stimulation of your follicles. Your follicles will be irregularly developed, and we're going to be getting you're going to get like kind of cysts within the follicles. So then we do ultrasound, we see cyst in the follicles. That's going to be more of a dive into polycystic ovarian syndrome. All right, choice number D is the correct answer. Endometrial glands and stroma in the myometrium. This is going to be adenomyosis. So this is me tenderness in uniform enlarged uterus and a sort of manipulation of the uterus through C-section or myomectomy can cause adenomyosis. Also, so any sort of, what are the two risk factors for adenomyosis? Okay, that's going to be C-section or any sort of myomectomy, because you're messing up the uterus. The second thing is going to be multiparity. So during pregnancy, we're going to get increased estrogen and progesterone that leads to abnormal growth into the myometrium. Okay, so this pregnancy, as we know, we're going to be getting increased progesterone from corpus luteum, and increased amount of estrogen is going to be generally produced, and that's going to be really messing up your myometrium. All right, choice number E, blastocyst in the ampulla in the fallopian tube. That's the incorrect answer. First of all, guys, she's actually elderly, 41-year-old female. Second point is, guys, she had these symptoms for 3 months. Okay, heavy menses for 3 months. This over here, blastocyst in the ampulla. Okay, ampulla, guys, remember it's like the outer portion of your fallopian tube. That's going to be that's going to be something who is a little bit younger. She has no menses, because if she has ectopic pregnancy, when you have pregnancy, we're essentially stimulating you're going to be basing on placenta. Placenta makes beta HCG, and beta HCG stimulates your corpus luteum. Corpus luteum makes progesterone, and progesterone maintains lining, okay? It opposes estrogen, and that's not going to allow you to have menses, okay? So that's going to be a really key underlying factor over here. Let's see what the explanation is. Yeah, so that's an ectopic pregnancy. That's going to be acute amount of pain, nausea, vomiting. It could be amenorrhea, which she does not have amenorrhea. So therefore, I didn't give you guys a negative pregnancy test, but that's not very important over here, because I did mention that she had 3 months of history, and she had heavy menses. If she had ectopic pregnancy, she would not have menses, and she would not have for 3 months. It would maybe be 3 hours, because it's an acute scenario, and she'd be slightly younger, like she's slightly older than that. Alright guys, so that was a basic question for adenomyosis. Recall that adenomyosis is going to be due to 2 risk factors: C-section, myomectomy, because you're kind of messing up with the uterus, so that's going to lead to abnormal amount of the endometrium into the myometrium, and you're going to be getting a pregnancy because you're getting more estrogen, progesterone, so that's also going to be there. Alright guys, so I hope you guys found this video. Thank you guys for watching this video, and I hope to see you guys next time.